Right. I suppose I should declare my areas of interest first of all. Apart from a geriatrician, when I was a young fellow growing up, I always had dreams of captaining Celtic Football Club. But it's very strange the way life can work out for you. I like to think myself working in partnership with an entirely different Celtic club. When we were actually created back around 2007, 2008, and Celtic and the Celtic image was very much in vogue. There was one Celtic lad dying. The Celtic Tiger started his death around that time when we were starting to start our life together. And there was a couple of rugby issues. The Celtic Crusaders, they were very much hovering on the edge, the rugby league side here in Wales. But thankfully they've recovered, and they're, although based up in North Wales. The Celtic Warriors, I'm afraid, never quite came back, so it's the Blues from here on in. So next slide please, and I'll tell you a little bit about this Celtic team. So the Celtic partnership that I work in now is a partnership between Age Concern Cardiff and Vale, the Cardiff University Health Board, or the Cardiff and Vale NHS Trust, and LHBs as they were called in those days, and Cardiff Local Authority. And it's a partnership that has really grown over the last few years, and it's culminating now in this model of a community resource team, which is what the Cardiff East Locality Team Intermediate Care Service functions as. So it's a partnership where we're co-located, we're all in the same building, we're integrated, sharing the same electronic patient record, and most of our case mix is frail older people. But like a lot of partnerships, when we work together, we have to try and cross each other's boundaries so that we can see what other people do and how we can work better as a result. So if I pop to the next slide, I'll give you an example of what the objectives were for our locality team. Essentially, we're going to provide community-based, comprehensive, interdisciplinary team input for older people. And that's where the evidence base for older people is in medicine. They don't just need a single professional doing things to try and make them better. It has to be cohesive and has to be joined up. The NHS can't do it on its own, the local authority can't do it on its own, and charities like Age Concern Cardiff and Vale can't do it on their own, because what older people need is all three working together and working cohesively and very much integrated so that everybody knows what everyone else is doing. So that's the key. It's interdisciplinary or cross-agency rather than single agencies doing their bit in isolation. So we also aim to provide care into care homes, because a very neglected part of older people's experience in health and social care is in care homes. About 5% of older people across the United Kingdom have access to multidisciplinary team working, and as a result, there's a lot of unmet need. And this is one of our key goals, to try and improve care for older people in care homes, and the knock-on benefit then for the health services, reduce admissions into hospitals rather than the other way around. We were also going to try and support chronic disease management plans, because a lot of older people, one of the great successes is that people get older, but unfortunately there does tend to be some comorbidity, particularly based in poor lifestyle choices when we didn't know that smoking was bad for your health, or that alcohol or working underground, etc. were all these things that were obviously essential at the time, but do carry health burden as you get older. We're also trying to enhance the experience of service users, and importantly their families and carers, who are a key partner in the work that we do together as three agencies. And the particular emphasis that I saw Age Concern in the partnership was trying to help those people who are most in need. My experience as working as a doctor in the health service, was that lots of people would tell you what they were entitled to and what their rights were, and very often you'd see people who just didn't have a voice, they weren't particularly loud, perhaps living in the wrong part of the city, or didn't have enough advocates to speak for them, and as a result very vulnerable and very much not benefiting from the services that they probably needed the most. And you see that in the health service as well. Typically for screening, the more affluent, better off population are more likely to avail of screening programs like breast screening, for example, than those who live in deprived areas or with higher levels of deprivation locally. We also want to provide value for money, and crucially to try and remove some of the barriers to interdisciplinary team working that happens quite a lot in organisations, particularly organisations where there are vested interests between each group. So this is the lovely building we have. It was actually an old GP surgery that was abandoned, and it looks a little bit more sprucier now, but it's basically the three agencies are co-located in this building. And in fact, one of the offices is where I now share an office with Joy, our Age Concern officer, and with Sharon, who is our team leader, team manager, or ward sister is the way I like to describe her, as a virtual ward. The paradox is that her husband is a committed Rangers fan, so you can imagine the conversations we've had this year, pipped for the title by the brink. So that's us based out in Clonrumney Avenue, and it's beautifully located geographically right in the heart of East Cardiff. And the reason we picked East Cardiff as our pilot area for this partnership was that high levels of socioeconomic deprivation are prevalent here. And we found that in the previous service I worked at ECAS, the Elderly Care Assessment Service in Rookwood, we found that those who were deprived were those who were more affluent were twice as likely to attend for comprehensive interdisciplinary team assessment compared to those from the more socioeconomically deprived areas. So a very good reason for targeting East Cardiff when we started off.